Hi everyone, my name is Arisa, and I'm excited to share my dissertation and what I've achieved so far with you. So my project is a simulation-based evaluation of tendon transfer surgery. Um, so it's basically that I use OpenSim to simulate different tendon transfer techniques and analyze its outcome to evaluate how it affects patients with foot drop. So let's start with some background introduction. So patients suffer from foot drop often have difficulty lifting their foot and present with a wobbling gait with high risk of falling. And one of the most common surgical treatment for this condition is tendon transfer. And tibialis posterior tendon will be transferred to the front of the ankle to help lift the foot. The original concept dates back to the 1930s when Dr. Ober first described the circumtibial routing method. Over the years, various surgical techniques have been proposed. For example, there are different routing methods, and there are also different attachment sites which surgeons could choose from. But here's the catch. How do surgeons know which techniques they should use? So currently, when comparing different methods, most outcome assessment rely on patient's subjective feedback, like how strong the patient feels and how satisfied they are. And if we want to look at some more objective outcome, we will often have to wait for a long recovery period before we can find that out. Therefore, the goal of this study is to create a biomechanical analysis to provide a more objective insight before sending the patient into the theater. This could help surgeons plan surgeries and predict what techniques might work better. And this is where OpenSim comes in. OpenSim is a open source software used to create digital models of the human body and simulate how muscles and tendons behave during movements. And my project was based on the Gates 2354 pre-book model. And this model represents a subject approximately 180 centimeters tall with a body mass of 75 kilograms. It has 23 degrees of freedom, and it includes the ankle, subtalar, and metatarsal phalangeal joints. I then used OpenSim's visual interface and Notepad++ to edit the muscle path to simulate the tendon transfer surgery. Now, looking into the study design, first I compared the two surgical routes, which is the circumtibial and interosseous routes, and then I reproduced a previous cadaveric study to investigate the optimal opening height on the tendon. And I also looked into different attachment sites. So what did I find at the end? When comparing different routing techniques, I found that the interosseous route turned out to be more biomechanically superior. And it also has a more balanced subtalar alignment, which makes it less likely to cause inversion deformity. And these findings align with previous clinical studies. Although interosseous route has better biomechanical advantage, if a surgeon decides to use the circumtibial route due to other patient factors, then finding the precise tendon opening height becomes critically important. This is because the height directly affects the bone, both the alignment of the tendon and the amount of tension placed on the muscle. In my simulation, I found that an opening height of 10 centimeters above the medial malleolus was the sweet point. And this finding aligns closely with what previous cadaveric study have reported. And going higher than 10 centimeters didn't provide any biomechanical benefit and could also increase the tension in the muscle, leading to muscle tearing. Lastly, I investigated different insertion points. Now, unlike what clinical study have reported, our biomechanical analysis did not show a significantly larger dorsiflexion moment arm. This might be due to limitations like simplified geometry or the way tendon wraps around the foot. However, where the modified technique really stood out was in the subtalar alignment. It significantly reduced the inversion bias. So although modified bars technique may not boost dorsiflexion directly, it offers a more stable, balanced foot position. So what does all this mean for clinical practice? First, the interosseous route should be considered when possible. Second, if the circumtibial route is used, 10 centimeter is the optimal opening height. And lastly, modified bars technique may offer better outcomes due to its improved alignment and torque balance. To wrap this up, this study shows that simulation tools like OpenSim can offer valuable, objective insights into tendon transfer surgery. And biomechanical simulation allows us to test and compare techniques safely, consistently, and without waiting months of post-op outcomes. So thank you very much for listening, and I'd be happy to answer any questions.